Hi, Kai Sing from Channel 8 and Channel News Asia. My first question is, okay, in your speech you said that we'll be moving to focus on detecting and treating infected cases. So will you be doing away with home quarantine orders and contact tracing, and when will that be?
I think home quarantine has its use because, for example, if we know that, and that's how we did for the soccer players, you know, when you knew there's a confirmed case and obviously there's close contact among the soccer players, then I think quarantining them while giving them prophylaxis makes a lot of sense. But at the beginning of the outbreak, when we extend the definition of close contact wider to include many more air passengers, so those, whether that is still as useful as now when there's a wider community spread. So those are the type of questions we subject ourselves to. So it is a shifting of risk management. That coming back to this outcome I was trying to explain just now, that each day there will be new cases. I think what we should be looking at is what is the mix of the new cases? How many are locally transmitted? How many are imported? A stage will come when there are many more local transmission than imported. Then you know, for example, that contact tracing at the borders become less useful. And not that it is not useful. It is, of course, of some use. But it is, in terms of deployment of limited resources, it becomes less useful.
So, can I say that contact tracing is still in place, but...
Yeah, we continue to contact trace, but depends on who do you define as close contacts. I think that definition we have to calibrate as we go along.
Okay, so just now you also mentioned that there's a Hong Kong soccer player who is detected.
I thought there was an earlier press conference by AYG.
Okay, but can we confirm that there are multiple cases at the?
You can check with your colleagues who was at the press conference. But what I was told was this: that the Hong Kong soccer team, they arrived a couple of days ago. Two of the soccer players had fever problems, before they left Hong Kong. So the Hong Kong authority was very professional in this. They did not allow the two to board the plane while taking the swabs from them, and then let the rest fly to Singapore. And then a couple of days later, when the two cases were confirmed to be positive, they immediately informed us in Singapore. So we immediately asked the Hong Kong soccer team to just self-quarantine in their hotel room while we take swabs. And that's how we were able to find out that 3 of the Hong Kong soccer players already in Singapore were now positive for H1N1. So, of course, the rest of the soccer team, I think they are already in Aloha, I suppose, like the Filipino soccer players. Yeah. But I must commend the Hong Kong authority in how they handle this very professionally.
Hi, Minister.
Hi.
Amanda from Razor TV.
Yeah, Amanda, yeah.
Hi. What are the chances that we can build up immunity against the H1N1 virus, and when do you see that happening?
I think let DMS answer this professional question.
I think once you have an infection, you will certainly develop immunity to the H1N1 virus. That's what happens during seasonal influenza. But as we know that with each recurring season, there is a risk that the virus may mutate. And if it does mutate, then there may be a risk that you will now be exposed to the new variant of the virus itself. So hence, although I would say that you would get immunity once you are infected, but it depends whether the next wave is going to be the same strain of the H1N1 or whether it will be different. If it is the same, you'll be protected. If it is different, you may run the risk of contracting the infection again, but it may be milder. If it is very different, then of course it could be much worse than what it was, and he may have a full-blown infection again.
Anything else?
Minister, schools are reopening soon, and you said that you will not be closing school at the moment, but when would it be considered serious enough to close the schools?
When will to close a school or all schools?
A school and all schools.
I think a school, even during mitigation phase, we have to examine each case. So, for example, you have a school where there's a significant cluster and it's spreading. It's worth closing that school because it will be effective in stopping the transmission in that school. But to close all schools just because of one school, when there is community spread, it becomes less useful. Because if the risk of getting it in Orchard Road is also significant, then why do you just because of one school, you close all schools, you see? Yeah. So these are the calculations that we have to make each time we have an incident.
Currently, any plans to close any school?
Currently, the schools are already closed because it's school holidays.
Like when school reopens, any school you are planning to close?
If there's a cluster, we are not aware of any cluster developing. Yeah. Anything else?
Yes, Minister Wan Ching from New Paper. When do you expect the next wave to occur? And how are we monitoring the virus's mutation?
Yeah, I think and that's why we formed this scientific committee chaired by DMS with quite a number of Genome Institute experts. And now that we have our own local virus, so they spend a lot of time looking at the genome, studying the genome of the virus. And our efforts are not unique. I think in many advanced countries with the capabilities, they are all doing the same thing. Is to try to track how the virus is mutating. And if it is indeed mutating in a significant way, will it become more deadly? And that's why the Brazilian press report was of international interest, because if indeed that was true, that would have been quite alarming. And fortunately, it was found out to be a flawed media article. Yeah. So that is how one will monitor. It is not guaranteed that it will definitely mutate in a deadly way. It just says, on the other side, it may well attenuate down and become milder. In which case, then all the expenditure on vaccines will go to, I won't say waste, but but these are difficult decisions one have to make. Yeah. And of course, when will the wave come is as equally uncertain. But of course, a lot of the worry is when the northern winter comes. You see, what is the concern? The concern is now that it is in southern hemisphere, and especially in our part of the world where H5N1 is already in the fowl population, and therefore the risk is the virus may then mix up with H5N1, and H5N1 is more deadly but less contagious. H1N1 so far is more contagious but less deadly, and you worry that you mix the two, you get the worst of both worlds. Yeah. So those are the concerns. As I remember the story when I was young, reading Einstein. One very beautiful girl approached him and said, "Why don't we get married? Then our offspring will be both pretty and as smart as you." Well, Einstein replied, "What about the other way around?" Okay, sorry.